But, there's the financial piece of it too, which we haven't touched on yet. But, healthcare is a financial privilege in America, and that's frustrating to me. The I'm about to be I'm shopping for healthcare right now because my husband changed companies, and the new company, offers him health care, but not me. So I've got to, find private health care or something like that. It's crazy expensive. And, uh, you know, lab tests are expensive, and supplements are expensive, and, prescription medications expensive. And, I just get frustrated at the system, I guess,
I mean, those are great questions. And being on my podcast, you'll get a copy of my book also. In fact, instead of sending you an electronic copy, I'll
Awesome.
send you a signed copy. And
Ah, cool.
it's called Sickened: How the Government Ruined Healthcare and How to Fix It. Will you stream that banner on there, Julie? There should be a banner under banners, just with my book information. Um, and and I understand what you're saying, and I will also say this is that healthcare can be inexpensive if you know how to shop for it. That's the key. First of all, you talked about it, shopping. Don't
Hmm.
just trust your employer for your healthcare. In fact, never trust your employer for your healthcare. Never trust the government for your healthcare. It's your own
Right.
healthcare. And ultimately, one of the reasons we started this podcast is because we want to educate and empower individuals to take charge of their own health. That also means financially. And let me give you a good example. And you'll read about this in my book. Health insurance, for instance. Jan and I got burnt out on health insurance 10 years ago or so, when we were paying $1,500 a month from something we never used. Okay. So we found something different. We have a health sharing ministry. Janet and I now, we pay $180 a month for our health care. And we get to choose our own doctor. We get to choose what things are covered. Very affordable. $180 a month for two people. Very, very affordable.
Hmm.
But you got to know those things. That's one of the reasons we have this podcast. One of the reasons I wrote a book, to educate people that $2,000 a month insurance is not the only option. You can do something
Right.
different.
Yeah.
And another thing is too, search out, one of the things that makes healthcare expensive is insurance. So insurance alone makes healthcare more expensive. So if your provider is taking insurance, they're billing higher prices. Those are just facts. I'm not beating up on
Hmm.
anybody that does that. Those are just facts. They have to hire extra people to do those bills. Over 50% of their staff is due to collection of insurance. So for instance, you can go to a direct primary care doctor, and you can have unlimited visits, 24 hours, 24/7 hour access to a doctor. You know how much money it is, Londa? I want you to guess.
Um, I don't know. I mean, you know, private the private plans that I'm looking at are between $600 and $800 a month. So I'll just guess that.
$75 a month. You can have unlimited access to a doctor 24/7. I'm not kidding you. They do not bill any.
Beautiful.
Yeah, they do not bill any insurance. It's a monthly subscription. They can do FaceTime consults. They can do texting. It's incredible. But people don't know those things. We're so stuck in the traditional health insurance model that that's all people
Yeah,
know. So then they
that's
think it's
true.
expensive. Well, health insurance is what makes things expensive, honestly.